Aloha, Mr. President. My name is Raghu Jufre. I've come from Hawaii with a simple Christmas gift for America, the repeal and replace of Obamacare. We know you will love it. You have stuck by your guns that America could do better than Obamacare. And in doing so, you created a 3-month window here in DC with the members of Congress that were forced to go back to the drawing board between the 3 and 4 times where you said we need healthcare reform. In doing so, I was able to get our little simple pamphlet into the hands of between 200 to 300 members of Congress. They have been primed for you. I would approach them and say, did you get our simple solution to the healthcare crisis? 10 to 15% of them would laugh right off the bat. There is no such thing, they would say. And I would say lifestyle insurance. It's a magical term. Somehow it has universal recognition. From taxi cab to mom to members of Congress, it has a recognition that it might be the answer because somewhere along the line the country has been educated about lifestyle. So the elevator speech, 50% of all medical cost is lifestyle related. It's a simple premise that is universally recognized. Number 2, government is covering the bulk of that. Again, another simple premise. This is when members started shaking their head. And then our closing line premise, if these lifestyle costs were handed over to lifestyle markets, we could reduce the cost of government healthcare, the cost of government actually, by as much as 50%. That's when their hands would go out and I would hand them a copy. So our favorite example, and this is the example that we want to present to you, is of smokers. As an example, if we took the smokers from Medicare, Medicaid, Social Security, the VA, you pull them together into one program, they will get a better service and it will cost less money. Now, the reason why this is our favorite example and the one that we are presenting to you is that it does not require government legislation. You already have full authority, Mr. President, in order to introduce such considerations. Because all this is really just a management upgrade. We are not asking for any new money. We are going to use the money already being spent by these government programs and see if this can dramatically improve the service while reducing the cost. So obesity is one of our favorite examples. We are spending $2 trillion a decade in America alone on obesity-related health care. Government is covering about 50% of that. That is $1 trillion, Mr. President. $1 trillion is now unfortunately being subdivided between 300 to 500 different healthcare providers, government healthcare provider programs. Therefore, none of them get the buying power of $1 trillion budget. Now imagine, we take that $1 trillion, we put it behind one program and approach the insurance industry and say, here's $600 billion, half the price. We want double the service. With that kind of consolidated budget, you get economies of scale. For $500 billion, somebody's going to figure out how to provide double the service at half the price. That is what economies of scale does for you. That is a 4-fold improvement. Double the service at half the price. That means that a $100,000 procedure would now go for just $25,000. These kinds of figures sound fantastic. However, they match up with the same kind of pricing that we get in all the rest of the developed nations that are offering double the service at half the price. So we don't have a logistical issue, simply a managerial and political one, and that is the reason why it is so fast and easy to take care of. So, Mr. President, all we're asking for is a simple tweet, #lifestyle insurance, Mr. President, and let Congress, let the industry, let the media, let academia take a look and see if these lifestyle markets is the answer to our healthcare problems. Thank you so much. I will send this around and see if we can get 10, 50,000, 100,000, maybe even 1 million thumbs up and request to have you take a second look. This is the answer that you've been looking for the repeal and replace. Big aloha from here at the Capitol. Yours, Mr. Raghu Jufre, reporting from Raghunomics here at Capitol Hill. Aloha.